Kia ora koutou, good afternoon everybody. I'll begin with some good news that once again today there are no new cases to report in the community and just one case in managed isolation. We'll get into the usual daily update shortly, but first we turn to our vaccination program. As of today, 18,000 people will have received their first dose of the Pfizer vaccine, with the initial focus having been on our COVID-19 frontline border workforce and now on their families. Yesterday afternoon we received the fourth batch of our Pfizer BioNTech vaccines. That shipment of around 64,000 doses arrived as air freight at Auckland International Airport, bringing the total number of COVID vaccines we've received so far to around 265,000, enough to vaccinate more than 132,000 people with the 2 doses required to get maximum protection. All of this has us in a very strong position as we move to provide details of the sequencing of our vaccine rollout, the focus of today's announcement. So today I'm announcing a targeted rollout over the next 3 to 4 months, initially focused on the 2 million New Zealanders most in the most at-risk groups. These are the New Zealanders most at risk of getting and spreading COVID-19 and those most at risk of getting seriously sick from it. Our plan also has a focus on those who live and work in places where they're most likely to pick up COVID-19. I can confirm that over 65s and those with underlying health conditions in South Auckland will start being vaccinated from the end of March. This plan further reduces the risk of future outbreaks, something that's been central to all of our government planning and prioritisation during the pandemic. We've been able to fully focus on this plan and the sequencing framework after securing enough Pfizer BioNTech vaccine for everybody in New Zealand to get 2 doses that they need to be fully vaccinated against the virus. It's a balanced plan that prioritises reducing the chance of future outbreaks whilst protecting our elders, those with underlying health conditions, and those who live in locations where we know outbreaks have occurred. We've seen the devastating impact that outbreaks in residential care facilities can have here and overseas. That's why this group of New Zealanders will start getting vaccinated later this month. Then all older New Zealanders aged 65 and over will be prioritised to start getting the vaccine from May. The vast majority of our COVID deaths have been people aged over 65, and we do note that that is a critical group to get vaccinated early. It's estimated that those over 65 have a 5-fold increase in risk of severe health outcomes if they were to get COVID-19. So there are 4 main priority groups. Group 1, where we're well underway, is our 50,000 border and MIQ workers and their household contacts. This started last month, and the vast bulk of that phase 1, that group 1, will be completed this month with at least their first dose. Group 2 is approximately 480,000 frontline workers and people living in high-risk settings, starting with 57,000 healthcare workers on the community front lines, and then moving through healthcare workers protecting our most vulnerable and some of our priority populations. This work also started in February and will continue through May. Group 3 are our priority populations. So this is approximately 1.7 million people who are at higher risk if they catch COVID-19. That group we plan to start vaccinating in May. And then Group 4 is the remainder of the New Zealand population, the approximately additional 2 million people that can expect to start seeing vaccines available to them from July. I want to be clear here, some of these dates may overlap and shift slightly as our modelling continues and also as we get greater certainty of our delivery schedule for vaccines, and conversations with Pfizer, particularly around those big bulk of deliveries we're expecting in the second half of the year, are ongoing. I want to reinforce that every New Zealander will be able to get a vaccine and that the vaccine will be free. The rest of the population will be able to be vaccinated from July onwards, and our plan is to have as many people as possible vaccinated by the end of the year. In further detail, approximately 40,000 courses are being allocated to our Māori and Pacific health providers who are working directly with older people, and as I've said, we're also recognising special circumstances in South Auckland. Anyone who lives in the county's Manukau DHB area who is 65 and older, or who has an underlying health condition, is in Group 2. This recognises that there are many border operations and MIQ facilities and their workforces that are based in this area, and therefore they are at increased risk. There are two further categories that we are still working on. One for people who may need to get a vaccine on compassionate grounds, and one which we're calling the national significance category, which could include people who need a vaccine in order to represent New Zealand overseas. Decisions around these categories have not yet been taken, but I will be taking more detailed proposals on those to Cabinet in the coming weeks, and we will share those as soon as those decisions have been made so that people can transparently see who is getting a vaccine and why. In closing, the message here is simple. This plan reinforces the importance of New Zealanders getting vaccinated. Getting vaccinated is the best way to protect our whānau, their lives and their livelihoods. The biggest factor in lifting COVID-19 restrictions will be timely and high uptake of vaccines. Again, it takes an enormous amount of work across a very wide range of people to roll out an immunisation program of this size, the largest such undertaking New Zealand has ever undertaken. And I want to thank everybody who has been involved in getting it to this point and who will be involved in the work that we take forward from here. I'll now hand over to the Director General for a few of the daily updates, and then we'll take your questions.
Thank you, Minister. Kia ora koutou katoa. So just a few additional comments on vaccines. It's pleasing this week to have started into that next phase officially of the immunisation program, which is the wider families and whānau of our border workers. Yesterday, earlier this week, the first large-scale vaccination clinic opened in South Auckland at the start, or as part of that official approach to vaccinating household members of border workers. And initially there will be about 150 people a day through that clinic, and scaling up very quickly to increase the numbers over the coming week. And the idea is that this size clinic will be able to put through around 1,000 people a day. Two other large-scale vaccination centres will open, one in West Auckland and the other in Central Auckland in coming weeks, and they will also initially focus on those household members, and then of course be used as we move down and out into those other groups. We're also partnering with Māori and Pacific providers to set up smaller community-based vaccination clinics in South Auckland to support the rollout. Across the country, 14 DHBs are now vaccinating, and more than 900 vaccinators have completed the bespoke COVID-19 vaccine module required of them in order to administer that Pfizer-BioNTech vaccine. This specific training module includes how to handle and give the vaccine, as well as information so that vaccinators can in turn answer the questions of the people who are coming to be vaccinated. Just a couple more comments on the daily update. As the Minister mentioned, there is one new case of COVID-19, a person in managed isolation who returned from the United States and tested positive at that routine day 01 testing. That person is now in the Auckland quarantine facility, and there are no new cases in the community. An update on the aircrew member that tested positive at the weekend. All close and other contacts to date have returned negative results. That includes family members and other members of the crew that came back on the flight from Japan with this crew member, and there are no new locations of interest. We're continuing to work with Auckland Regional Public Health on possible sources of this crew member's infection. I'm pleased to report that the outstanding gym goer from our Auckland February cluster or outbreak has been contacted, was tested last night, and has also returned a negative test. So our total number of active cases today is 80, and the total number of confirmed cases since the start of the pandemic in New Zealand is 2,054. Yesterday, our labs processed 8,618 tests, and our grand total to date is now 1,795,324. And so far we have also had, since the 1st of January, 37 historical cases out of a total of 243. Thanks, Minister.
Gina.
It's the compassionate and national significance categories. I appreciate you haven't decided who will be in those, but what is the sequencing of those? Will they be available at the same time as Group 2 or Group 3?
So that's one of the decisions that Cabinet will have to take, as to exactly where they sit, or whether that's a continual availability for those groups. That's a decision that's yet to be taken.
Should it be that they are vaccinated before Group 3?
Look, again, like I said, that's a decision that's not yet been taken. We'll work our way through that, and we will share that, because it's important that people know exactly how we've prioritised. We have not made decisions on that particular group yet.
Why have you not made decisions on that? Is this compassionate grounds in this national significance category just not something you'd thought about?
No, it will be a relatively small group of people that we're talking about here. They'll be the bar to access a vaccine under those criteria will be a very high one, and so that's actually the work that we're doing now, is just to make sure that we get that sufficiently tight that it's not open to abuse.
Of New Zealand is the only information they're getting today is that from July until the end of the year you'll be getting a vaccine. When will they have more certainty, and how will you prioritise those 2 million people in that fourth group?
So as we get closer to the middle of the year, and probably closer to May actually, when we start to really ramp up in anticipation of the bigger rollout from July onwards, we will be able to share more information, including things like details of of larger scale events where we'll be making vaccines available to a large number of people in locations. We'll be able to share that more towards the beginning of the year. But
or how will that work?
again, that's something that will partly depend on deliveries and when we get greater certainty around that. At the moment, the team are working with Pfizer, and we have reasonable sort of certainty around exactly what's getting delivered roughly 6 weeks into the future. But we're aiming to really kind of get more detail around that. We are confident, though, based on discussions so far, that we will have our full allocation of Pfizer vaccines in country well before the end of the year. So we're confident of that based on our discussions, but the exact sequence of when they arrive are still being locked down.
How far will your existing stock take you to right now? Like the amount of vaccine in the country right now, how far will that take you to?
I think I mentioned that in my introductory notes. We've got 265,000 doses, so that's about 132,000 courses, or 132,000 people who can be covered by that. But we are expecting regular shipments. Broadly, I mean, you will have seen that the last few shipments have been around that kind of 60,000 mark, 50 to 60,000 mark. We're expecting regular shipments to continue over the next period of time, and we are expecting the full 250,000 courses to arrive in the country over the coming month.
The prioritisation of aspects of the South Auckland community, I mean, surely that's more to prevent sort of severe harm, less than actual outbreaks within that community, because it'll be less than half of the DHB population that you're vaccinating at that stage. Why not vaccinate more and really protect against outbreaks?
Look, it's a combination of things. As I said, we obviously want to reduce the risk of outbreaks, but we also want to reduce the risk of people being adversely affected. One thing I do want to say at this point around the table that you have all been given is that the lines, the horizontal lines, are not absolutely hard and fast. So, for example, we would not necessarily say we have to do absolutely every one of the 57,000 people in Tier 2A or Group 2A before we moved to Group 2B. If, for example, a frontline non-border worker, health worker, presented for vaccination in that Tier 2A group, and they had a close household contact who was more at risk, who was in the Tier 2B group, it may well be that they both get their vaccinations at the same time. So we're already seeing a little bit of movement around that. For example, as we've been doing our border workers, they were our first priority. When they reached towards the end of the day, if they had extra vaccines that were made up that they hadn't yet used, they would start vaccinating the frontline health workers with those extra doses. So we don't want to lose, we don't want to waste any vaccines. So that's also part of our consideration. So this is the broad grouping, but there's discretion to have slight movement within that.
Yeah, but why was the decision made not to vaccinate the South Auckland community, a great amount of the South Auckland community in the 2B category?
There is actually a reasonable proportion of the South Auckland community covered by the 2B category, but as you'll see from that, that we're talking about those who are more at risk because of their relevant health conditions. So we want them to be first before we move on to the broader population there.
On from July, and I appreciate this is not all worked out yet, but the full shipment won't be here in July, it'll be here at some point at the end of the year. Does that mean that it won't be first in, first served from July? There'll be some kind of prioritisation, even if it's random, even if it's, postcode lottery or something, but there will be some kind of prioritisation.
Look, I wouldn't call it prioritisation and so much as logistics. So some of what happens in the second half of the year will be controlled by logistics, by making sure that we're getting the vaccines out quickly, because obviously, given the volume of vaccines we're expecting, we don't want to have them sitting in our ultra cold freezers for a prolonged period of time if we can avoid that. So logistics will play a role there as well.
Major people in major centres might be more likely to get the vaccine earlier on from July because, the vaccine's going to be sitting in Auckland, sitting in Christchurch.
We'll release more details about that as we get closer to the time, in terms of, geographical spread, the actual rollout. Again, logistics plays a role here, not just in terms of the vaccine distribution, but also in terms of workforce as well. So potentially being able to make the best use of our vaccinators by moving them around if we need to. So that's all that detailed planning work for the second half of the year is well advanced, and we will share that well in advance of when it happens.
Sorry, I'm curious about that. How many vaccines can you hold safely, at the deep freeze right now, and how many vaccinations can you give out a day, and are you ramping that up?
I'll ask the Director General to comment on our current capacity.
So I don't have the exact figures, but we've got the 9 freezers. I mean, it's hundreds of thousands of doses, and obviously, as things start to ramp up over coming weeks, we'll see more flow through the freezers. And whilst we will need to always keep a stock there for the second doses of people, because their clinical advice is still 3 weeks after the first dose, and that's what the approval is for MedSafe. We're confident we've got plenty of freezer capacity at this point in time. So saying, the team is looking at whether or not we might need additional extra cold freezers for the second half of the year, and also what the impact is of being able to store the Pfizer vaccine at that -20, which is the normal deep freezer type temperature, for a period of 2 weeks, which will help with the logistics as well.
Can you please say when is the first person who's going to be fully vaccinated and inoculated against COVID-19 due to happen? And then moving through the groups, so does someone have to have 2 jabs? That group have 2 jabs before you then move to the next group?
So next week, obviously, we'll start our second round for those who were earliest on in the piece. There's a 3-week gap between doses. That's what the MedSafe approval is based on. That's what our technical advisory group continues to recommend. I am aware that in some other countries they've delayed the second dose because they're dealing with an outbreak, and therefore they're just prioritising everyone getting a dose before they move on to the second dose, or delaying the second dose in order to maximise the number of people who can get a first dose. We're not in the position to need to do that in New Zealand. It's something that we keep under review, but at the moment our plan's still based on the 2 doses 3 weeks apart.
So everyone will get 2 doses before you move on.
know that they're supposed to be...
can we just clarify that answer
Yes.
that you just gave? So everyone in group 1B will get 2 doses before you move on to 2A.
Like I said, the lines, the horizontal lines here are not hard and fast. It's an approximate sequencing, because there'll still be some discretion at the front lines for those doing the vaccines, so that they're making sure they're making the best use of the resources available to them and the people who are available to them at the time.
But the thinking is you get 2 doses before you move on to the next group, or no?
The way we manage our inventory, we'll be managing our inventory to ensure that we can give people their second dose within that sort of, just shortly thereafter the 3-week time period. Sorry, we'll come back over here again.
Know that they're being sort of invited to get a test. Are they going to be sent out letters on how is this online tool going to work?
Sorry, you mean to get a...
get a vaccine.
To get a vaccine. Look, the online tool is primarily just a resource for people to be able to look up where they sit in the queue, if you like. So it won't be particularly sophisticated. It won't give you a huge amount more information than the information that we're setting out here at the moment. But it's simply a way for people to know and to understand what all of this means for them in a way that's very digestible and easy for them to understand, rather than have to try and interpret the sequencing framework themselves. Audrey?
Within each group, will there be any advantage if your surname begins with A as opposed to Z?
No.
Just clarify, I mean, in other countries,
So how
people are
will
being...
it be?
Well, we'll just let Audrey finish that one. Yeah.
Yeah, so within each group, how will it be sequenced?
Ultimately, there is a booking system that's being used. I'll get the Director General to comment on the booking system. It's one of the IT solutions that's being put in place. In terms of our border workers, I can say that it's largely been determined based on their shifts when they were working. So we worked our way through their shifts, but there will be a booking system to make sure that we're creating the right framework here, but I'll let the Director General comment on that.
Thanks, Minister. So there'll be a range of ways whereby people will be able to either book online themselves, or they will be contacted by a provider. It might be their GP or a Māori or Pacific provider. There will also be opportunities for just walk up, walk in. But just on this issue of how do you decide where and when once you get to the wider population, clearly not everyone can be vaccinated on the same day or even week or month. And so there will need to be, we're putting thought into what's the best way to use the capacity in the system, and as the Minister mentioned, that could be thinking about doing it on a regional basis, so we can use at the peak we will need hundreds, if not over 1,000 or 2,000 additional vaccinators. It may well be we use them, or a portion of them, in regions to do those larger scale events. Meanwhile, while there is background vaccination happening through, for example, general practice, or it could be at pharmacy or through Māori and Pacific providers. So it will be a combination.
But I can assure you the youngs won't be disadvantaged by the alphabet.
Now, a question of sports stars. Have you kicked a decision about that down the road because of emerging community sentiment against it?
No, not at all. It's just we haven't worked through the finer details of that. One of the things that we're very mindful of, if you think about the compassionate grounds, for example, you have to construct those very, very carefully to ensure that people don't create compassionate grounds to get themselves ahead in the queue. So we've worked through this with our managed isolation facilities, for example, and the emergency allocation criteria, and we will certainly be drawing from that experience when we consider the compassionate grounds that may be applied to people accessing. But it will be, again, I just want to be clear here, that these will be quite small groups of people. That will not be, it's not going to be a backdoor way for people to push themselves up through the queue.
A small number that it seems odd not to give people them. But in any case, will you guarantee that Olympians and Paralympians who are due to compete in July, none of those athletes will be forced to make a choice between competing, which they've put their heart and soul into for the last 4 years, and travelling safely? They'll be able to be vaccinated?
Look, I'm not going to comment on sports teams because we will set out that national interest criteria very clearly once the Cabinet signed that off, and I don't want to get into to who will be covered by that and who won't until the Cabinet's actually made decisions on that.
Can basically give up their...
Compassionate ground be?
What was that?
What could the compassionate grounds be?
There'll be people who absolutely have to travel for some kind of emergency situation. But again, the criteria for that will be quite restricted.
Like a relative dying overseas or something like that?
Like I said, it'll be similar to the emergency criteria we have to access an MIQ space at the moment. But the Cabinet's not signed those criteria off. As soon as they have, believe me, I will tell you.
In terms, given you're speaking about a national significance category in terms of the sports stars, can we take that to mean that the cricketers won't be able to travel to the IPL, which they're not representing New Zealand at?
Look, again, national significance is not just sports teams that we're talking about here. We're also talking about diplomats who have to travel overseas, trade negotiators, a variety of other, national interest groups. And again, before we absolutely set all of that out, I want to get my Cabinet colleagues to go through that carefully, and I'm sure that there will be quite a lot of discussion about that before we release all of that. Jessica,
do you appreciate though the urgency in this for some of those sports people and I'm sure business people and diplomats, the clock is ticking very loudly.
Oh, look, they won't have to wait that much longer. We're talking about a week or two. It won't be a long period of time they have to wait.
In terms of your decision to include South Auckland people over 65 in that earlier category, when did you decide to add that in to the mix?
Oh, look, that's been a discussion over the last couple of weeks. Really, this has all firmed up since we had certainty around the access to the Pfizer vaccine. Because, of course, you'll be aware that there's debate around which vaccines were most suitable for the over 65s. So we weren't able to lock that down until we had absolutely locked down which vaccine we were using, which was the Pfizer vaccine. So it's in the last few weeks.
So pretty recent that you decided that South Auckland needed to be a priority.
Well, look, all of this has been, I think you would have heard me talk about this over the last few weeks when I've been asked about the principles that underpin this framework. It's about people who are most at risk and settings that are most at risk. And I think I've said for some weeks now that we recognise that South Auckland, particularly those who are in and around the airport, that's a setting that's more at risk.
Will Kiwis who've been vaccinated still have to go through MIQ?
At this point, yes, and we have not made any decisions to change that at this point.
When will you start reviewing that?
Look, I think we can plan on the basis that that's going to continue to be the case for some time yet. When we get to the point where we may want to consider that, we'll tell you more about it.
Surely there'd be an easy way to carve out a few people from the MIQ system to free up a few spaces.
Look, there's still issues to work through there around the science involved. There's still issues to work through there around the efficacy of different types of vaccines, bearing in mind that, the people who are coming in won't all be part of our Pfizer campaign. So we've got to work through some further science, and it will be science and health that underpins our decisions around that rather than anything else.
So the Olympians coming back through, in August...
You don't look like Henry, but that's okay.
Same hair colour. But so when the Olympians coming back through, say in August, September, they will likely have to go through MIQ.
Look, again, I don't want to preempt decisions that are that far away in the future, but the Olympic Committee will certainly be planning on that basis.
On the National Significance test, would that include cabinet ministers who might want to go to, say, COP or other international fora? And if it did, would a politician be making that decision, or would you throw it over to a bureaucrat? Look,
again, this is one of the reasons I don't want to get into this discussion yet, because until you actually have a clear criteria, deciding who's in or who's out I really can't give you a comment on that until that's absolutely finalised.
Do you have any concerns for the safety of under 16-year-olds, and are there any plans to use a different vaccine to vaccinate them?
I'll have the Director General comment on that.
Thanks, Minister. So, look, we continue to watch what the emerging studies are showing around, which are trialling the vaccines, the 4 vaccines in our portfolio on under 16s. I think what I would say is we would have a reasonable level of confidence that the Pfizer vaccine will be one of the first to present data, and also one of the ones that a priori we would imagine would be safe in under 16s, but we are waiting for that information to come through from the trials. We have enough vaccine, Pfizer vaccine, should the data and evidence come through, we have enough vaccine to vaccinate the under 16 population in accordance with what the trial data will be showing.
Yep.
Are you concerned about the safety of those people?
Not in the current situation, because we're continuing with an elimination strategy, which is protecting all New Zealanders, and we have managed isolation as a key part of that into the future as well.
I'll spread this around a little bit. Yep.
The July target for starting with the general population is set after some countries overseas are actually expecting to have vaccinated their entire populations. Are you expecting that there's going to be pushback from New Zealanders when they see that their friends and families overseas have already been vaccinated and we haven't even started with the general population yet?
Look, ultimately this is determined by the supply of vaccines, so we have to make sure that we're providing equitable access to vaccines based on when we know vaccines are going to be arriving in New Zealand.
Will the national significance category include business people?
Look, I can't sort of reiterate this enough times. At this point, the Cabinet hasn't made decisions on that. As soon as they have, I'll let you know.
So, and the 9 black caps that are due to go overseas to play in India, they won't be vaccinated. What's your advice to them?
Look, same answer as I had before. Cabinet hasn't made decisions on that, on who's covered by that national significance criteria.
This week, they've run out of time. You've not prioritised them in the list.
Yep.
Should they travel?
Look, ultimately they should follow public health advice.
Public health advice.
The public health advice around anyone who's travelling, I'd encourage them to talk, in New Zealand cricket, to talk to public health professionals.
So do they
about
just
that.
have to suck it up, those they can't go overseas and play, and that's
Look, the national significance criteria, as I said, hasn't been set yet. As soon as it has been, we'll let you know what it is. We'll come back over here, yeah.
If someone's been through MIQ, hasn't paid their fees yet, and then they go to leave the country without paying, would you consider stopping those people at the border?
Sorry, run that one past me again.
So say someone's entered the country and gone through MIQ, they haven't paid their fees, and then they go to leave New Zealand without paying, would you consider stopping them at the border to try and get that money off them?
Look, I'd have to check whether the legal framework allows for that, or whether we would need to change the legal framework to allow for that. I'll come back to you on that one. Audrey.
Where do the Cook Islands and the realm countries come in the sequencing?
So that's still part of an ongoing discussion with the governments of those realm countries. As soon as we've sort of finalised that with them. So they have to make decisions, for example, about whether they want to use Pfizer or whether they want to use one of the other vaccines. So those are discussions that are ongoing with them. So the reason they're not included in this framework today is because we don't have certainty on that. Now, that's not all down to New Zealand. That's also their governments have to make some decisions of their own, and then we'll work with them on the basis of those decisions that they take.
Do you have any advice on pregnant women having the vaccine?
So at the moment, our advice remains the same, that the pregnant women should have a discussion with their clinician about the benefits and potential risks, and that's a clinical decision and one for them to make on the basis of that discussion. Jenny?
You mentioned this morning about the systems not being ready yet for the vaccine rollout, so what still needs to be done to get those databases up and running, the booking system up and running? How soon until we can see that actually in force?
Well, I can just sort of briefly rehearse what I said this morning. The key point at which we will need those larger systems to be in place will be for ahead of that wider population rollout. So the aim is towards the end of May. In the meantime, our systems are there to help deliver the vaccine through these priority groups. And the important thing here is integrating those 4 different information systems and making sure it is all working well and able to support that wider population rollout, which will be then, delivering thousands, possibly tens of thousands of doses every day.
I guess because there's half the population are pretty much in those priority groups, why are they not ready for that?
Oh, they are ready for that, so we can continue to scale up with our current approaches, but it's when we go to that wider approach, we need to have integrated the booking system, the recall system, the immunisation register, and the track and trace system, because it's a much larger scale venture.
The systems that we have running at the moment are going to be good enough for this there's 2 million people about to be vaccinated before we go out to the public.
Many of those people in those categories that have been announced today will fall ahead of July, so we will be ready to go for that much bigger scale up, particularly from Category 3.
Clarification on Category 3A. Your table says that it's people over the age of 70, and then after it says it's people over the age of 75. Which is it?
Look, I'll have to come back to you on exactly who the 17,000 figure was arrived at, as to whether it's 70 plus or 75 plus.
And just in terms of pregnant women, I mean, they're being included in Category 3C, so the government is encouraging them to get their jabs early. Just in terms of the earlier question, you said it was something up for them and their professionals, but you are encouraging them to get the jab early.
Encouraging them to have a conversation with their health professional.
But they're having early access.
They will be under this, yes, under Category 3C. And they're also, for example, included in the annual influenza rollout, flu vaccine rollout. They are included in that category of people who are eligible in that high priority category where it is publicly funded.
Okay, we have to have the last couple of questions.
Minister, Judith Collins has called for the TransTasman bubble to be opened. Can you report any progress on negotiations on this? What's currently stopping the bubble from being operational?
Ultimately, certainty around what we do in the event of outbreaks on either side of the Tasman. The Australian government's position has shifted around a bit in terms of their response. It's clear that the response framework that we were originally discussing with them is something that they would no longer use in making those decisions. So we have to recalibrate at our end to consider how that will how that affects our response.
Can you just be clearer about that? Because I actually don't understand what that means when you say unpredictable responses. What does that change?
Well, my understanding is they've introduced a new testing requirement as a result of just our most recent set of cases, which wasn't there previously and wasn't something that had been discussed previously. Their suspension of the green zone, or their green zone, and the various decisions that they have taken about that following our recent outbreaks, again, wasn't consistent with the framework that we had been speaking with them about. I still don't think these are insurmountable issues, and so we continue to talk with them. Bear in mind at the moment their state-by-state approach is still leading to different outcomes. So at the moment, Victoria and New South Wales are allowing people to come in, but other states are not, come in from New Zealand quarantine-free. And bear in mind too that their willingness to do that is based on New Zealand being completely COVID-free, and even the smallest incursion of COVID into our community prompts quite a significant response from Australia. Look, we're just working through all of that. It has been a difficult process, but I'm still optimistic about it.
New Zealand could do the same way as Australia tomorrow. It could open a green zone and close and open as it needs to.
But one of the things that we have to work through is making sure that we're absolutely clear about what may happen if the green zone travel was suspended by either government for any reason, in the context of a much larger movement of people. So with Australia allowing New Zealanders to travel over to Australia without quarantine, that's still a relatively limited number of people. When we get to the point where you can travel both ways without quarantine, we're talking about a much, much larger group of people. And so that's what adds a bit more complexity to it.
So what you're saying here is that Australia's actions on previous closures of the green zone haven't been in line with what your expectation would be. Therefore, you can't trust going forward. At this stage, you can't trust how they would respond if a bubble was open.
No, look, these have been ongoing negotiations, and there's been good faith on both sides. So I don't want to create the impression that there isn't, that's been an issue. The issue is that the framework that we were originally talking about, as things have unfolded, has not been the framework that we now find ourselves working to. So.
How they would respond if there is a greater outbreak and the bubbles.
I think ultimately, if I could characterise it this way, the early discussions were based on sort of joint decision making around any response to an outbreak on either side. I think where we're now getting to is that both countries will reserve their positions to respond in a way that country wanted to in the event of any kind of event, and so therefore the settings that you have around that are look quite different, and so we're working our way through that.
Unilaterally previously, and it caught you by surprise?
Well, they've kept us informed with the decisions that they have been taking. I'm going to have to dash because I've got to go to the question.
Given you agreed with the Australian government to do that back in May, that's 10 months ago, and now you're having to change routes, change plans.
Events. Things have happened in that time. It hasn't all been plain sailing. There have been outbreaks on both sides that we've had to respond to and deal with. There is good faith in these discussions, and I'm confident and I'm optimistic about the way they're proceeding. And as soon as we have more details to share on that, we will. Last question, Amelia.
How are things looking for Auckland moving to level 1 for the weekend?
I'm optimistic, but we've got a little bit more work to do on that. Thanks, everybody.